أشهد أن لا إله إلا الله وحده لا شريك له وأشهد أن محمدا عبده ورسوله أما بعد فأعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Dearest Hazur, respected Amir Rafiq Hayat, respected Chairman, Humanity First International Ahmadiyya, respected Chairman, Humanity First USA Munam Naim, and other country chairmen, Humanity First colleagues and Jamaat members from around the world, Assalamu alaikum wa rahmatullahi wa barakatuhu. May the peace and blessings of God be upon you. It is my honor and privilege that Humanity First International Medical Director, Dr. Shahnawaz Rasheed, asked me to speak about the topic of medical and surgical missions, a path to sustainability. Today, I will begin with sharing some information about best practice guidance from the World Health Organization and other international entities, and then transition into sharing some of our experiences from Humanity First in trying to build sustainable training and education programs. I want to start by acknowledging that I'm presenting the work of so many others, some of whom I will do my best to try to acknowledge at the end of this presentation. First, let's discuss what's available from the World Health Organization as it relates to standards for medical and surgical missions. The WHO has standards for regulating foreign medical teams in sudden onset disasters, but they do not have standards for non-disaster regular medical and surgical missions. Beyond WHO, the Partnership for Quality Medical Donations and AmeriCares, from which Humanity First routinely receives supplies, has published standards for medical and surgical missions not occurring during the times of disaster. These are more comprehensive guidelines focusing on mutual alignment, respect between the sender and host organizations, and moving away from a treat and leave model, and recommend that all efforts be highly focused towards training and capacity building in a sustainable manner. What's also interesting is that non-adherence to best practices by foreign medical teams is now being more challenged and called out by in-country medical leadership. This is happening in both the medical and surgical communities, but being a surgeon, I thought I would share these two articles from two prominent leaders. Dr. Emmanuel Ame from Abuja, Nigeria, has written an article entitled Opinion, It's Time to End Neocolonialism in Global Surgery. Dr. Abebe Bekele, who's the former dean of the Addis Ababa University in Ethiopia, wrote an article entitled Global Surgery, Pro-Con Debate, A Pathway to Bilateral Academic Success or the Bold New Face of Colonialism. The good news is that Humanity First is not alone in our work to adhering to best practices around surgical system strengthening and medical partnerships. The Global Alliance for Surgical Obstetric Trauma and Anesthesia Care, also known as the G4 Alliance, is an organization that I've had the privilege to support, which is focused on advocating for the more than 5 out of 8 billion people around the planet who do not have access to surgical trauma, obstetric, or anesthesia care, a population that has been termed the neglected surgical patients. As for the global health programs within Humanity First, we have focused on many of the same principles: collaboration and empowerment, capacity building, bilateral medical and surgical education, improving service efficiencies, and sustainability. So how have we applied these principles within Humanity First? Let's showcase some of the work from the last 15 years where Humanity First has been running surgical education programs. This was built upon the partnership initially set up by Dr. Agha Shahid Khan of Baltimore, USA, who identified an urgent need for general surgery education, particularly in Ghana. This was formalized into a partnership between Humanity First International, UK, USA, and Ghana in 2006, and this expanded to include Liberia in 2009. The purpose was to expand surgical expertise and local capacity through a train-the-trainer approach. As we were exploring which specific Humanity First training courses should be developed, the history of how the exact topics were developed is interesting. Certainly, the overwhelming numbers of patients who needed groin hernia surgery made it natural to set up a training course that taught local surgeons how to utilize plastic mesh as part of their surgery. Surgeons who attended the Humanity First Inguinal Hernia Repair course were taught how to use mesh, and also Humanity First provided them with 1 year's supply for their patients. The formalization of the second Humanity First course is what took us by surprise. We thought laparoscopic surgery, which is keyhole surgery, usually requires video towers and more equipment, so it would have not been our choice for the next Humanity First course to be organized formally. However, it was the Ghanaian and Liberian surgeons, both within the Jamaat and outside, who told us that the people of Ghana and Liberia need laparoscopic surgery more than us in the US because their patients need to get back to work more quickly. One surgeon said to us, quote, "If some of our patients do not get back to work, there may not be food on the table," unquote. Thus, we benefited greatly from this bilateral partnership in education, and the Humanity First laparoscopic skills course was then developed. Here is one of the news clippings that respected Amir Sub Ghana, Abdul Wahab bin Adam, and the Humanity First team in Ghana shared with the Humanity First USA team after our return. This clipping is from the Ghana Chronicle newspaper, and it details how we first helped the University of Ghana Korlibu surgeons perform the first ever laparoscopic surgeries in children during the 2009 surgical education visit. The Humanity First surgical education courses in inguinal hernia and laparoscopic surgery have occurred regularly in Ghana and Liberia since 2007 on nearly an annual basis except for gap years due to Ebola and COVID. These courses occur in partnership with the local Humanity First branches as well as members of the professional associations and the regulatory boards. The Humanity First courses have been held at the Ahmadi Muslim hospitals in Kokofu, Daboasi, Swedra, Asakore, as well as at teaching hospitals in Ghana, such as the Korlibu Teaching Hospital, as well as in Liberia. Let me share some highlights from both of the courses. First was the Humanity First Inguinal Hernia course. That is the 2-day course that helps local surgeons learn how to use plastic mesh as part of the hernia repair. The course has a morning classroom session followed by afternoon operations in which participants help repair different types of hernias. There's debriefing sessions at the end of each day to summarize lessons learned. Another milestone occurred in 2011 when respected Amir Sub Ghana Abdul Wahab bin Adam presided over a successful inguinal hernia course held for the Nusrat Jahan doctors at the Daboasi Hospital, after which Amir Sub devised a plan with the special blessing of Hazrat Khalifatul Masih to expand these medical educational activities to an international regional conference, also with the intent of trying to help to meet the requirements for local continuing medical education credits as urgently needed by Ghanaian and West African doctors. This resulted in a 2014 milestone where the first international CME conference was held in partnership between Humanity First and Nusrat Jahan. This first international conference was presided by respected Amir Sub Abdul Wahab bin Adam and held at the Daboasi Hospital in the Western region in Ghana. In addition to the inguinal hernia training course that was offered as part of the proceedings, there were also medical and surgical topics more broadly focused on continuing medical education. By the grace of Allah, international delegates participated from 6 countries: the United Kingdom, Sierra Leone, Burkina Faso, Nigeria, Pakistan, and the USA. On the right here, you can see some of the pictures from that event. Respected Amir Sub actually traveled at that time, and we found out later he had a severe injury in his back, and yet he absolutely made an extraordinary effort. And this is sadly earlier in the year, in the same year that he passed away. Let me share some highlights from the Humanity First laparoscopic skills course as well. This was offered regularly since 2009 in Accra. The most recent course was in February 2019 at the Johnson & Johnson supported MSSI Surgical Training Center at the Korlibu Teaching Hospital. Participants included 33 surgeons and operating room staff from 6 countries, including Ghana, Liberia, Burkina Faso, Togo, Nigeria, and Benin. Here you can see on the left-hand side is the flyer that they used to promote the event, although certainly Humanity First did not charge for our participation, but for the food and the necessary cost of the continuing medical education credits issued by the uh, Ghana Medical and Dental Council, as you can see at the bottom, those is what the charges were for. On the right, you can see the classroom setup. On the top right, you can see some animal surgery being done. That's actually Sadr Majlis Khudam Ahmadiyya USA doing anesthesia on a pig there. I heard he's very good at it. And then on the top middle, I apologize, the pictures are small, but those are the towers that practiced, that are being used for laparoscopic surgery practice. These types of long-term partnerships can have many supplemental benefits. One example here is that Humanity First supported the building of a medical laboratory and X-ray building at the Debasi Hospital in 2014. Another example is that there are opportunities for academic partnerships to study the introduction of new surgical techniques in LMICs. This is a research paper published in the journal Hernia, which assessed the impact of the Humanity First hernia course. This was done under the mentorship of respected Amir Sahib Abdullah bin Adam, who took a keen interest in this, as well as other leaders of Humanity First Ghana. Similarly, we have been talking about a train the trainer approach and training surgeons, but certainly these types of programs have impact on thousands of patients who get operations either directly as part of the course or, more importantly, indirectly after the farm medical teams leave. This also can have a dramatic impact on individual patients. This boy's name is Safa, and we have his permission, and you may remember he was featured in the Humanity First telethon as well. And Safa had a large tumor which was potentially curable but could only be operated on safely at a quaternary care hospital. And Dr. Daniel Ree, who was the surgeon on that visit, saw this boy and made the decision to try and seek additional care. Dr. Ree from Johns Hopkins arranged for free care at that hospital, including rehab, and in coordination with the Humanity First International, USA, Liberia, and the Ahmadiyya Muslim Jamaat USA, his travel was arranged for and his visa so that he could get the necessary care. There's a picture of him and his father. Siafa had his operation on October 8, 2019, and by the grace of Allah, it was very successful. Here you can see Siafa and his father, who came to thank respected Amir Sahib, Mirza Maghfur Ahmad, for his support of his stay. As for acknowledgements, there are so many who did this work. Huzur is our inspiration, and it was his prayers, love, and guidance which allowed much of this work to move forward. May Allah protect and strengthen Huzur's every prayer, word, step as our guide for all of our Humanity First activities. So many volunteers, trainees, residents, fellows, students, for which we can only ask Allah to reward, but important administrative support was provided and needs to be acknowledged, including respected Abdul Majid Tahir Sub and Private Secretary Sub, International Chairman Ahmadiyya Sub, from the HF UK team, Fazil Ahmed, Dr. Aziz Safiz, Dr. Shahnawaz Rasheed, Dr. Hammad Khan, Umar Safir Sub, Dr. Muzaffar Chaudhry, from Ghana, respected Amir Sub Ghana, Abdul Wahab bin Adam, as you heard, played an instrumental role in many of these activities. Here's a picture you can see on the top right there, along with the former chairman of HF Ghana, El Hajanin, who also helped with the laboratory and X-ray building that were built. The current Emir, respected Mohammed bin Saleh, has also been, without missing a beat, incredibly supportive of Humanity First activities. You can see his picture there, second from the top. Mohammed bin Saleh, I already mentioned, Al-Haj Farouk Abdul Wahab Isa, named Chief Masab Dr. Ibi Muhammad, Dr. Majid Al-Hassan, Dr. Ibrahim Muhammad, Dr. Muhammad Bashir, Mahmoud Butt, Naeem Ahmed, Mubashir Najim, Rafi Ahmed, and Fatima Khambati. In Liberia, respected Amir Sub Naveed Ahmed Adil has provided extraordinary help over this time as well. You can see his picture on the bottom right. Respected Naib Amir Neen Sub there, Chairman HF Liberia, Dr. Abdul Halim Arain, who's one of the most dedicated souls. The respected Minister of Health, Dr. Wilhelmina Jella, Dr. Francis Kate, who's the CMO, also was head of Tapita Hospital, Dr. Lawrence Sherman and Jefferson Sibley at Phoebe Hospital also have been helpful over so many years and hosted us so graciously over so many years. HF USA, you saw respected Amir Sab was so gracious in supporting that one patient in many of our programs over the years, and respected HF USA Chairman Munam Naim, Mahmood Qureshi, Director of Operations, Walid Khan, Bashir Malik Nazat Salek, Aga Shahid Khan, Naim Lugmani, Iftikhar Ali, Saqib Ali, Dr. Daniel Ree, who has been on many trips, Dr. Gazer Ortega, Dr. Tariq Yusuf, Karen Cartwright, Madil Abdullah, and Rashida Rana. I will end with the final prayer that it's our heartfelt supplication to Allah Almighty that may accept these humble efforts to serve His creation. Ameen. Assalamu alaikum wa rahmatullahi wa barakatuh.